Okay, your time is up. Are you ready?
Okay, let's start.
All right, start.
Hello, good evening.
Good
Come on
evening.
and have a seat, please.
Thank you.
Thank you. I'm Dr. Dalia Abbas. I'm the treating doctor for today.
Mhm.
May I confirm your name, please?
Yes, just call me John. Thank you.
Hi, John. Sure. And your age?
I'm 38, doctor.
Okay. Uh, Tell me, how can I help you, John?
Well, the reason I'm coming today, doctor, is that I have this funny sensation, and basically it's a bitter taste in my mouth, and
Mm-hmm.
I'm having it all day, but it specifically bothers me in the morning, and sometimes I have this burning sensation in the back of my throat, and I don't know exactly what's causing it,
Uh-huh.
doctor.
For how long you feel this thing? Please tell
Uh,
me.
it's been quite some time, doctor, but it's been really bothersome in the past few weeks.
Okay. Does anything make it uh, worse or better?
Um, like I said, it's mostly in the morning that's bothering me, but again, it happens throughout the day. But I've noticed that it happens mainly after I eat like heavy meals.
Okay.
Mm.
Okay. Any specific meals, please?
Uh,
Maybe you mean spicy meals or oily meals?
yeah, that's exactly what I had in mind when I said heavy meals,
Okay.
like oily meals. Yeah,
Sure. It must be stressful. Sorry to hear
it
that.
is.
Okay. Okay. Uh, I want to ask you a few further questions, please, John, if
Please,
you
doctor.
don't mind.
Hmm.
Okay. Have you got a fever during this period?
No, not that I remember, doctor. No.
Yeah, any sign of abdominal pain, maybe stomach
Uh,
pain,
no, I don't have any stomach pain.
any vomiting or
Uh,
bloating?
God, no, no.
Mm, Okay, no problem like this. Uh, I want to ask you about your maybe lifestyle,
Mm.
your job. Is it
Uh,
a stress? Is it stressful job maybe?
I wouldn't call it a stressful job, doctor. It's a desk job. So yeah, I'm managing quite well.
Uh-huh. Okay, it's
Mm.
good. Uh, do you have any regular sports program
No,
or exercise?
no, I don't have time for that, doctor. No.
Yeah. Okay, I believe you have what we call gastroesophageal reflux disease. Do you have any
Reflux?
idea what is
Oh
it?
my God, reflux? I've read over the internet. They
Don't.
call it
Oh,
it's what they call a
please,
precancerous thing.
uh,
Am I gonna get cancer,
please
doctor?
don't bother yourself by these names. It's just a reflex of acid from your stomach to the lower esophagus, which connect your mouth to your stomach. Don't bother yourself by this idea, maybe a wrong idea or maybe non-specific. So it's not specific idea or good idea.
Mm,
Okay.
mm. What can we do about
So,
that, doctor?
okay. Let us start step by step. Maybe.
Mm,
First step, I want you to regulate your diary program. I think your diet will be the keyword of this problem. Other
okay.
thing, you may increase your exercise during that next period of your life.
You mean
And
start doing
maybe,
exercise because I don't?
yeah, you have to. You
Mm,
have to maybe to join some nearby gyms or something like this.
mm, mm. Right, but going to the gym, I don't have time for that,
Okay,
doctor.
you have it.
Mm, right. Anything else I
I
should
think
be doing?
you may join nearby gyms. Yes. Uh, may, okay. It's a last step, maybe.
Mm.
It's what we call endoscopy.
Oh,
Do
okay.
you hear about it before?
No, what is that, doctor?
Okay, it is some camera kind procedure.
Mm.
Uh, when you insert the camera in your mouth to see what's happened in your stomach. Please, it's quite benign condition till now. Nothing to be afraid from it. It calm. Some medication and exercises, dietary control will improve your problem.
Right. Doctor, you haven't told me anything about medications. What sort of medication are we talking about?
Okay, sorry. Uh,
Your
if
time is up.
time over,
Okay.
I'm sorry.
All right. No, it's okay. It's okay. That's what practice is for, right? So that we can make
Yeah,
mistakes,
yeah.
figure out what
There's
is happening.
okay, some noise around me for a
Yes,
while, so I'm
yes, I've
sorry. So
noticed.
yeah, it's
I've
something
noticed. You got
bothering me. So,
distracted. Yeah,
yeah.
I noticed that in the last minute you got distracted.
Yes,
Okay.
yes,
Especially
okay.
when you brought up the whole endoscopy
Yes.
kind of thing because
Please
it
just
says
score me. You have to stay.
all right. And I'm not gonna score you for that. It's not a fair
What
trial,
do you
so to
think?
speak. You got distracted. Okay, I understand that. But there are a few things that I wanted to go over like quickly.
No, no, no problem, no problem. I want really, I want to know. I want to know my situation, my level. I want to know it. I want
Um,
some. So
what I
just
can
give me some score, everything
um
from your experience.
what I can assure you is that it's not a B. It's definitely not a B. Okay, so it's going to be way
Okay.
below that. Okay, and my understanding is that everyone in here is trying to score for a B at least. So yeah, you're not in
Yeah.
that category, right? But again, what I said is that this is not a fair trial. You got distracted, and I can hear that. So I don't think we should take that into consideration. But there are a few things that I wanted to draw your attention to throughout the whole
Okay.
thing, right? So one of the most one of the issues that many of the doctors face is trying to fit the whole thing into can I mute you just for the sake of the sound?
Yes, yes, yes,
Yeah. All right.
yes.
If you can mute yourself so that you can unmute if you have any questions, that would be all right. So what I wanted to say is that one of the things that many of the doctors face some kind of difficulty with is trying to fit all the tasks within the allotted time, and it is quite a challenge trying to fit all the points into the 5 minutes while allowing the patient to give you some input and trying to build some sort of rapport throughout the conversation. So yes, it can be quite challenging, but there are a few things that I like to direct your attention to that would save some time. And one of the things that you have done personally is that in the very beginning, instead of saying hello and then waiting for me to reply and saying, well, you know what, come and take a seat and that sort of thing, you can try to fit it into one sentence, right? So that will be more time efficient. So you can say something like, and that's the only part of your conversation where I would advise you to have something like a stock phrase. And a stock phrase is a phrase that you use in each and every consultation. So you can say something like, "Hello, my name is Dr. Dalia. I'm one of the doctors here. What may I call you? What brought you to the hospital today?" Anyways, figure out whatever works for you, but the thing is, if you say it at one go, that could save some time. Let me bring up the chat box here because um, Dr. Ahmed Seif says here, is it accepted to talk a lot about the symptoms while task is only to ask about difficulty in swallowing? Again, Dr. Ahmed, I would say what I always say is that at the level of the OET, it's very advisable to stick to what is written on the task. Try not to go astray away from the task because, again, you've got the time element, and the time element is not gonna allow you the luxury to venture into anything apart from the task itself. So if you want to play safe, and I do advise you to play safe, try to stick to the task. So yes, I would ask about regurgitation, but again, there are a few things that you could be asking about. So you could be asking about smoking, because obviously, if Dr. Deli asked, I would have said, you know what, I do smoke. I was asked about exercise, and I did mention that I don't do any exercise whatsoever. And that's the second point that I wanted to direct your attention to, is that there has been so many signposting, so to speak. So you ask questions, you say that the words, well, you know what, to figure this out, I'm going to need to ask you a few questions. If you're going to say that, that's called signposting. Do it once. Don't do it like before each and every question, or before every set of questions, right? Just do it once. Your time does not allow you that sort of thing, okay? So if you say, well, you know what, John, thank you very much for coming in order for us to figure that out, we're going to need to ask you a few questions. Would that be okay? Yes, doctor. If you said it that way, you don't need to say it again, okay? Um, uh, what else I wanted to right, and there's another thing when you talked about like the whole modifications and me trying to do some exercise and what have you. You said you need to increase your exercise. And I caught you on that because what I said is that I don't do any exercise whatsoever. And part of the marking system is how attentive you are to the patient and whatever they're saying, right? So if I said that I don't do any exercise, it doesn't make sense to tell me you need to increase your exercise. What you would say is that it's advisable that you start doing some exercise. And if you try to make it easier for the patient, basically what you're trying to do as a doctor is trying to get me move, right? So I would say like a couple of walks every other day, that would be more feasible for me, and that would be more encouraging for me, other than telling me, you know what, you need to subscribe to to your nearest gym or whatever. If I don't do exercise and someone comes tell me, you know what, you need to go to the gym, no thank you very much, I don't have time for that. Yeah. um Dr. Mary here says, I think Dr. Delia was in her to speak about endoscopy. Yes, as it's written, not warranted. She got distracted. I can assure you of that, and I could hear it. I think that the patient was going to ask about it, and our rule to say it's not indicated at the time being. I have the I don't think you need to worry about the role player card anyways. I wasn't going to ask about, it doesn't say on my task that I should be asking about endoscopy, but what I would say, what it says is that after Dr. Delia would have told me about the whole medication and the lifestyle thing, that I shouldn't be like convinced about whatever she's saying, and then I would ask for some kind of a specialist advice, right? So that's my role play. Now, you said something about medication, but you didn't mention what sort of medication, even though it is on your card. So it's very important. If I would try to tell you what are the things that you should be working at, I would say that you should be taking it one step at a time. So if you're trying to fix everything at the same time, then you're not really doing anything. What I would say is that the first thing that you need to start doing is to try to fit your task, like all the items of your task, within the time limit. That's the first part. You get that handled, and then you move to another part. But on the positive side, what you did is that when I said that I was having so much pain and discomfort, you actually said, "Oh, I'm sorry. I think that this might have been so stressful for you," and I like that because it shows that you listening to me and you're showing some sort of empathy. So yes, thank you very much, Dr. Delia. If you could come to another practice session so that we can practice more cards, that would be very helpful. But for the time being, if you can try to fit your task within the time limit, that would be very helpful. If you have any questions, please come to the mic again before we move on. For the other doctors, if you guys have any questions about the role play that we just have, please type in the chat. And I'm going to move on to the coming role play in a minute. I wrote a question up. Not gonna call you Dr. iPad, but let me try to go up and see. Is it okay to look on the card, or is it better to memorize the points? All right. I am very big on maintaining eye contact. I think it helps you big time in terms of making the conversation sound as natural as possible. And if you're trying to memorize everything and just not look at the role player, it will appear on the recording. Doesn't matter how much you try to hide it. Think about it. If you have a conversation, right, with someone and you're not looking at them, how much of the nonverbal cues you're getting from them, right? But if you're looking at them and they're looking at you, then chances are you're going to have a natural conversation, just like the ones you have in your own practice. But if you keep the card in your hand, that would be really helpful as well, because every once in a while you can break eye contact, look into your card, just make sure that you're following the right direction and you're covering all your tasks. Those are the things that can help. So a mixture of both to answer your question. Keep your card, maintain eye contact, break eye contact every once in a while just to check if you're going with your tasks and you're covering all of them. That would be very helpful. I hope I answered your question right there.